Welcome back. We are discussing the killers, cancer risks, and health. So, we are discussing the second leading cause of death in the US, which is cancer, which in a non pandemic year has usually about 600 deaths per year. So, let's talk about the types of cancer and what leads to these types of cancer. So, one thing I do want to mention is cancer is not one disease. So, we learned about how cancer is disease of one cell, and that really leads to cancer not being one disease. Even though it is the second leading cause of death, it is made up of many diseases. And that's because it comes from one cell. And one cell can cause many different types of diseases. It can cause carcinomas, which arise from epithelial or organ linings, which are skin cancers, breast cancers, uterine cancers, prostate cancers, lung cancers, GI tract, sarcomas, which are cancers of the fibrous tissues, muscle cancers, bone cancers, cartilage cancers, lymphomas, which are cancers of the lymph nodes and the immune system, and leukemias, which are cancers of the blood cells and bone marrow. So they're all different types of cancers depending on which cell they arose from. So whether they arose from cells that are skin type of cells, or if they're blood type of cells, or if they're fibrous type of cells. And they're all different types, and they're all different types of diseases. So don't think of cancer as one disease. It is many types of disease, and that makes it hard, as you've heard, to treat. So, cancer risks and deaths, they are different in many. This is from your textbook, and you'll see there are lots of new cases of cancer versus lots of different types of deaths. For females, there's a lot of um, new cases of breast cancer, but the number one cause of death of cancer is actually lung cancer. And for males, there's a lot of new cases of prostate cancer, but again, the number one cause of death of cancer is lung cancer. And why is this? There's many types of reasons. Some of the reasons are research, screening, treatments. Our lungs and our bronchus are very buried in there. So sometimes when you have symptoms of cancer in the lungs and things, the cancer can be a lot further along than your breast and prostate. We have a lot more screenings for breast and prostate cancer than we do for lung cancer. So we can catch them a lot earlier and treat them a lot more. So there's various differences why. Uh, for the differences in the new cases versus the differences in death. It doesn't mean that they're not any more or less important, but that's how you read these two different lists. Is we get a lot of new cases, but there is a difference in dying. A lot more of the internal cancers can be more deadly because the screening for them and knowledge about them is a little bit more difficult, for sure. Um, So going over some of these, death is much larger for lung cancer. It is the leading cause of cancer deaths in both female and male, and then followed by breast and prostate. And then colon cancer for both. So yes, lots of things to be aware of in cancer and cancer screenings and health. Other things to be aware of for cancer risks for different types of people. Breast cancer, African American women are nearly twice as likely to be diagnosed with triple negative breast cancer, which is more of a harder to treat cancer and more genetically dispersed through African Americans, and more likely to die African American women. So that means screening is more important. Well, screening is important for everybody, but screening and knowledge is very important for the African American community. Kidney cancer for American Indians and Alaskan Natives is very prevalent, and they have the highest rates of kidney cancer and death in the United States. Liver cancer for American Indians, Alaskan Natives, and Asian and Pacific Islanders are really, really high. Liver cancer, for sure. Prostate cancer in African American men are more than twice as likely to die from prostate cancer. So that is something to be aware of and get more checks for sure. Women in rural areas are twice as likely to die from cervical cancer. And African Americans are more than twice as likely to be diagnosed and die from multiple myeloma, which is a blood cancer. So there's a lot of things that go into these risk factors. Genetics can be one of them, but as we remember, only 10% are genetics. A lot are environmental. So some of those environmentals can be healthcare access, socioeconomic factors, chemical and physical exposures, diet, and physical inactivity. So definitely things to be aware of and that we will chat about. So can cancer be prevented? So remember, mutations in those genes and those cells that create cancer, 10% of those mutations are hereditary and 90% are environmental factors. So 10% we can't do much about, right? We can't change our genes yet, although scientists are working on that. But what can we do about that 90%? So from the American Cancer Society, they really say these steps: stay away from tobacco, be safe in the sun, eat healthy and get active, avoid alcohol, protect against HPV, and find cancer early. So we're going to go through these environmental factors and talk about them. So tobacco and cancer. Tobacco is the leading cause of cancer and death from cancer. So over here is a picture from the American Cancer Society. This is all of the cancers known to be caused by tobacco. I know that a lot of people know that lung cancer is caused by smoking and tobacco, but there is a lot of cancers that are caused by tobacco and tobacco products. Um, Mouth and throat, voice box, acute myeloid leukemia, kidney and pelvis, renal cancer, uterine and cervical cancer, urinary and bladder cancer, colon and rectal cancer, pancreas, stomach, liver, all types of bodily cancers are caused by tobacco. It is the leading cause of cancer. I think most people think that it is lung cancer. Smoking leads to lung cancer, and it definitely does, but it leads to a lot of types of cancers, which can be surprising to many. It is increased risk of cancer because tobacco and tobacco products and secondhand smoke have many chemicals that damage that DNA, right? And it is that DNA, those genes, especially those proto-oncogenes and those tumor suppressor genes, that we really want to keep intact so that our cells don't grow abnormally. E-cigarettes are new, and more research is definitely still needed around those types of tobacco products, including e-cigarettes. But they do still pose, the American Cancer Society does say that they still pose health risks to the user because it's tobacco and the chemicals in the tobacco. People who quit tobacco usage, regardless of their age, have substantial gains in life expectancy compared to those who continue. Also, quitting at the time of a cancer diagnosis reduces the risk of death. So tobacco and cancer are super highly linked for sure. Sunlight and cancer. Us as Californians really like the sun. So it is something to be aware of. Most skin cancers are a result of exposure to UV rays in sunlight, both basal and squamous cell cancers. The sun lamps, and tanning booths, which are less popular these days, but still kind of popular, give off ultraviolet radiation. Exposure to UV radiation causes early aging and skin damage, and it's really the UVA and the UVB rays that cause that damage to the DNA. And that's really what we are trying to avoid, the direct damage to the DNA and that uncontrolled growth. The sun rays are the strongest between 10 a.m. and 4 p.m. The American Cancer Society suggests that you wear a hat, sunglasses, and at least SPF 30 if you're going to be outside between the hours of 10 a.m. and 4 p.m. No matter the color of your skin. Lots of people, I myself included, have a darker skin, and I still wear sunscreen, mostly for vanity because I don't want to get wrinkles, but also because it protects me from skin cancer. I wear SPF 50, just to let you know. Alcohol and cancer. I think a lot of people don't associate alcohol with cancer, but it does have a link to cancer. Drinking alcohol increases your risk of multiple cancers: mouth, throat, esophagus, liver, voice box, breast cancer, colon, and rectal cancer. It has been suggested that certain substance, I think a lot of people have heard this over time, that red wine, substances in red wine, such as resveratrol, have anti-cancer properties. While that might be true, like resveratrol by itself might have anti-cancer properties in a petri dish, there is no evidence that drinking red wine, especially in excess, reduces the risk of cancer. So you can't get around cancer by drinking red wine. In fact, it's the opposite. One study estimated that it would take more than 35 years for high risk of laryngeal and pharyngeal cancers, so that throat type of cancer, associated with alcohol consumption, to decrease to the level of never drinkers. So people that were drinkers and got high risk of throat cancers, that stopped drinking, it would take 35 years for them to decrease their risk. The American Cancer Society's guideline says that it's best to not drink alcohol, but people who choose to drink should limit their intake to no more than 2 drinks per day for men and 1 drink per day for women. There is stronger guidelines on that, on what accounts for as a drink. It is very small. So definitely there's a lot of links between drinking and cancer. Eat healthy and get active. I know a lot of these things that we've been going over are like stay healthy and get active. This one is interesting. At least 18% of all cancers diagnosed in the US are related to excess body weight, physical inactivity, excess alcohol consumption, and or poor nutrition, and thus can be prevented. Being overweight can cause 13 types of cancers, and these, the bigger the dot, the more prevalent the cancer is based on being overweight. So you can see breast cancer and bowel cancer are largely associated with it, and as well as womb or uterine cancer, kidney cancer. And one of the reasons is because being overweight can lead to increased inflammation overall in the body, and increased inflammation can lead to damage to cells, and that damage to cells is what causes that, those multiple mutations in the DNA. So staying at a healthy weight and being physically active throughout life, following a healthy eating pattern, and avoiding limiting alcohol may greatly reduce your risk from developing or dying of cancer. And protecting against HPV. This one actually is my favorite to talk about. HPV, human papillomavirus. HPV causes 6 types of cancer: vaginal cancer, cervical cancer, vulval cancer. So anybody with a vagina, a cervix, a vulva can contract those. Anybody with a throat, an anus, or a penis can also contract cancer. So it's not just anybody with a vagina. Anybody with a penis, an anus, or a throat can also contract cancer from HPV. I think sometimes it's thought of as anybody with only a vagina or a cervix, but lots of people can contract HPV no matter your sex. So HPV causes 6 types of cancer. We have been racing for the cure for cancer and lots of treatments for cancer. HPV is the only type of, although HPV isn't a cancer, it causes 6 types of cancer, and we have a vaccine to 6 types of cancer, which is super amazing. And I don't think it gets enough credit. I think it doesn't get enough credit is because it's linked to sexually transmitted diseases. But lots of people have HPV and didn't get it through sexually transmission. But it's really great. There's no treatment for HPV, but there is a vaccine that can prevent it, which is super awesome that there is a vaccine that can prevent HPV, which thus there is a vaccine that can prevent 6 types of cancers, which is super amazing. The American Cancer Society recommends that that females and males get HPV vaccine between the ages of 9 and 12. So if you have any children, it's better to get it young. Teens and young adults can get it through the age of 26. It has been approved for people to get it up to the age of 45 as well. So if you have not been vaccinated, you can get it to the up to the age of 45 and protect against HPV and 6 types of cancer, which is super, super cool. There are other ways to protect against HPV as well, and practicing safe sex, asking, knowing your status of HPV, as well as getting annual pap smears. The PAP in pap smear stands for papillomavirus or human papillomavirus. So knowing your status. So there's lots of cool things about protecting against HPV. And then finding cancer early is the last thing. So if you can't prevent it, finding it early is one of the really huge things you can do to help stay healthy. Screening increases the chances of detecting certain cancers early when they might be easier to treat. So breast cancer, you can do mammograms. It's suggested to have mammograms every 1 to 2 years after the age of 40. Cervical is pap smear. Again, that tests for the HPV, human papillomavirus, beginning at the age of 21. Colon and rectal cancer, looking for that. Prostate cancer, annual. Sometimes pap smears can be annual, sometimes every 3 years. Skin cancer screening, you can do self or dermatology and self-exams. Testicular cancer self-exams, breast exams, self-exams. There's lots of things you can do just looking over yourself and knowing your own body, and checking for any signs of cancer. So finding it early detection is key in the fight for cancer. Okay, hopefully you enjoyed Cancer Week.